We want to go back to Susan Elizabeth Littlefield, who is outside of Children's Hospital. We just spoke with her, but she joins us now with, I think, somebody that she's been talking to. Susan Elizabeth?
Yes, I wanted to come back to you guys. I mean, the details that Jennifer just told us, that kind of stuff that we are hearing all day. I mean, mental health is such a theme of this day. So right now I have joining with me the head of mental health services, Dr. Sarah Jerstad, here at Children's Minnesota. And I just want to ask you, first of all, Doctor, how in this moment you start conversations with everybody?
These are never easy conversations to have. There's no good news in this conversation. And for families who have kids, this is a really difficult conversation because kids are just getting ready to go back to school. They're scared, they're terrified. So the first conversation a parent should have with their kid is to say, how are you doing? And to listen and to be there. The second thing is to understand what kids are fearful of right now. What are they afraid of? Parents and adults are the source of comfort and support for these kids. So to really be there for them. And third, just to listen to what questions they have. Kids are going to wonder what's going on.
Yeah, and on that note too, some kids are already in school today, and they're going to get home from school. They might not know what's going on. What's your thought on, should you loop your kids in on this?
This depends on the age of the kid. For really young kids, they may not be aware and may not understand. But even kids in elementary school are probably going to hear about it. So it is best to start that conversation because as the parent, you want to be the one having that dialogue with the kids. Kids are going to probably wonder, are they safe to go to school tomorrow? Are they okay? And that's going to feel scary to both. And even when we look at data and say, yeah, you're most likely safe, the feeling of fear is there. So it's a real good opportunity to listen to their fears and to start to put a plan together for the coming week.
And speaking of plans, Dr. Jerstad, I mean, I know that Children's has told me that y'all prepare for mass casualties. I mean, what's it like in your head right now knowing you have a plan and you got to enact it?
This is something no one ever wants to actually put forward, but we have to plan for it. So the main things that we think about, of course, our medical providers are here on site doing everything they can to help kids. We are available for mental health support. We know that families who are affected just simply because they're fearful, they've watched it, maybe calling in, seeking support, seeking extra appointments, we're available to provide that support. And then if families who are affected need extra help, we're going to open up for that help. We're there to provide guidance and provide the most support possible in a difficult situation like this.
And you bring up the medical providers. I know their mental health is incredibly important. All the first responders today, and this is the first time we've seen something of this size here. What about, you told us about the children, what about the parents? I mean, they're having to have these conversations, and you saw the faces. I mean, the biggest feeling of just grab my chickens and hold them close to me tonight. So many parents just going to be hugging. What can they do for their mental health in this moment of crisis?
Yeah, parents are absolutely affected, and teachers and caregivers, everyone is affected. And not only do they feel like they need to hold their kids and support them, but parents and adults are going to need their own support. And it's easy for parents in this situation to think the only thing I'm going to focus on is taking care of my kid. But to do that well, those adults and those parents need to take care of themselves. Many adults out there have their own therapists or mental health providers. And so I would encourage them to access those folks for extra support and certainly seek support from friends, family members. People come together in these kind of situations and create community together. And that's one of the biggest kind of healing components there is.
Yeah, community is going to be huge. What about, do you think, just for today? As far as conversations, as far as breathing, what should we all remember?
Something for today is simply to be close, be together, and recognize what each person needs. Each kid and each parent is not the same. Some kids might need to go in their backyard and play. Some kids might need to do something for distraction, and that's going to be really helpful too. Some kids may need to sit and talk about it and express their feelings and ask and get a plan for what would I do if something like this happens. So I think parents need to take that cue from their kids in terms of what's needed today.
And then also as far as what's needed, I know there's so much information out there and a lot of people just kind of compulsively checking and reading and looking at the images. What's your advice on how we absorb this?
We can only absorb so much. So when we get a lot of negative information, it sends our kind of anxiety into overdrive. So I would say stay informed, keep up on what's happening. But again, give yourselves a break, give yourself an opportunity to get support from others and talk to others and model that for kids too.
Model that. Well, we thank you for the care you provide here and all these medical providers. I'm sure you guys are going to have support for them as well.
Absolutely. That is something that we never forget, is that our caregivers here are humans too, and they're going to need support, and we will absolutely be on top of that.
We know this is a long game. Thank you so much.
Of course.
Appreciate it. Yes. So you heard those powerful words here of people just holding their kids tight and just listening to them tonight. I think it was excellent words of wisdom on a day that's hard to quantify.
Absolutely, Susan Elizabeth. Definitely helpful information from Dr. Jerstad about how to talk with your kids and that you really need to take care of yourself as a parent too to be able to help them.
And listening might be all that some parents have capacity for, because they're still in this moment trying to process everything they've gone through, and just the panic and the fear of going to school today and not knowing, trying to reconnect with your child. There's just a lot that they're navigating as well.
Absolutely.